Between 2011 and 2016, the Johns Hopkins Center for Communication Programs, in partnership with several local organizations, implemented the Ssdi Communication Project. The project, which was supported by the United States Agency for International Development, aimed to promote social and behavior change in 6 priority health areas that included malaria, nutrition, water, sanitation and hygiene, HIV and AIDS, family planning, and maternal, newborn and child health.
Basically, in terms of our approach, it was moving from research to identify gaps to developing what we call an evidence-based communication strategy, which was also informed by theories around how and where to intervene, and then implementing interventions that would address the gaps and challenges that we saw around the 6 health topics that the project was designed to support the Ministry of Health on.
To capture interest and influence emotional response for action, Ssdi Communication created a branded concept that was a unifying theme used across all campaign messages and communication materials for all audiences. Moyo Ndi Mpamba, usamalireni. Life is precious. Take care of it.
Apart from producing the billboards, the posters and the leaflets, we also have designed and broadcast radio programs through which we influence people's behaviors through sharing of experiences as well as modeling of positive behaviors.
Estimated to reach over 20% of the adult population in Malawi, Moyo Ndi Mpamba radio drama, coupled with a reality radio program that featured real stories from real people, registered high popularity evidenced through audience feedback obtained from SMSs, social media, and personal testimonies of impact.
Nisadayambe kusata njira zakulera timvera wairesi nakazanga nthawi nake madzulo anafotokoza nkhani zokhudzana ni kulera koma ine nimavuto omwe nakhani kumana nawo pa Mpamba pano sinimasowa nthawi yoti mwina mwake nkupezera ngakhale chisamaliro cha anaja nati akuli bwino titani tisate njira yokhalitsa ya pankono.
Kuyambirira 2014 inamba kumvera siwero la Moyo Ndi Mpamba muzi mwaguza munagwa kolera anavuta kwambiri anthu amapuluka ndipo kolera mafala tipita ku chipatala sinaona chosambira manja chabwino tabwera kumene kuchako nawo za bambo ndata ndaona china chake bwanji tifotokoze apa tizitha kusamba manja tikachoka ku chimbuzi kuti tisamangisamba manja apo kujapo khai kapena pokonza chakudya mwaso tikachoka ku chimbuzi tisamba manja nyengo yonse ya mvula ije yadusa koma kolera sinativire inagwa kolera chapafupi koma ife sinatitani sinatipezi.
Designed for community members with low literacy, a family health booklet, also referred to as the passport to a healthy life, was distributed to over 80% of households in sites selected for community mobilization. Over 3 million people in Ssdi district were estimated to benefit from the booklet with integrated essential health messages.
Namunanga adalenga 1997 mwana osikisi na amene ali pa khunduyi zali sangalatsa kwambiri abambo okaniperekeza pamimva mwana ali kumanjayi nkupeze kuti ali chinthu yone sangalatsa zedi chifoti kuchipatalako dapita limodzi mpaka kufika kupekesesa sikelo fe mpana kumene kujaku adanipasa mankhwala amagazi koma chonyendeso kwambiri ifone kuti matinka yola mwa mankhwalawo abambo amanikumbutsa mpaka nufikana pano pana abambowo tikumata ndi mwabebe usikelo ndi mwana ayiru uperekezana maunga amene atera phunzirira mpaka na beba nopa zikakhali ndizonesangalatsa kwambiri pa nyumba panga moti kamene popo chikondi ndizera chikondi mpaka na pano mpaka na kalekale.
In addition to the family health booklet, volunteers from community action groups received community health workers' flip charts that they used to facilitate discussions around aspirations for health and barriers to achieving health, as well as actions that families, individuals, and communities could take to take care of their lives and health.
Kutabwera alangizi pakumpanga anandifotokozera nditutsalensetane kuchoka pamenepo panapezeka kuti luntha lidanipeza pang'ono nidapanga dongosolo lokoza garden pekale nimapezeka kuti nikupita ku trading ukagula koma panopo zamasamba ndikuzipeza pa khomo pomwepo kusonyeza kuti upangiri chakudya yosapezaso zoti zamasamba monga zamagulu 6 zili mutiso momwe muchokera mmasamba amene ndalima mnyumba mwangamo pa garden yangayo kusonyeza kuti nyama nimatheka kugula kuchokera mmasamba. Ana wanga amakhala omasuka kosangala kumapita so sukulu moyenerera.
We use the power of entertainment to take musicians, artists, and these artists would come from, national level, but also combined with artists from the local level. In each of the districts would do a tour and would basically link up with service providers so that places where the health, promotion road shows were done were also sites where services, were being provided on spot.
Other support materials and interventions included a marriage counseling guide that targeted young married couples in churches with essential health messages, a Music4Life Initiative under which media houses promoted health reporting and national dialogues surrounding priority health issues, and a malaria comic book that equipped pupils with knowledge on malaria prevention and care.
We have great examples under community mobilization. We have seen communities lobbying for bicycle ambulances. Communities have received shallow wells and boreholes. Some members of parliament have helped them with iron sheets, and communities have come up with clinics in the villages.
And when all was done, not only individuals, families, and communities told stories of change, equally, leaders of health programming had a story to tell.
Malaria communication strategy, which was from 2009 to 2015. So part of it was implemented with Ssdi communication. And we also worked together in the development of the second generation of the communication strategy of 2016 to 2020. But I'm proud to say Ssdi has contributed to the increase of coverage of almost all interventions.
Most of the newspapers, be it the print media or audio, the radios, you see health issues were always there. People demanding the services that we need to improve ABCD. That was what I can say as the biggest achievement of Ssdi communication.
Finally, like a declaration of faith, Moyo Ndi Mpamba has become a brand that stays at the heart of households as an emotional commitment to take care of life, to prevent disease, and promote wellness. Life is precious. Take care of it.